and you used the term in your menopause episode, Patti, about democratization. And
Yes.
that's exactly what we're seeing with Neutrogena. They're allowing us to democratize beauty and wellness for the skin at incredibly low price points.
Yeah, I love it. Making it available to everybody. The other thing they're doing, which is, I think, a huge focus, is testing on all skin types, all Fitzpatrick skin types. That whole pre-aging study that they did, looking at aging turning points in various Fitzpatrick skin types. Obviously knowing that darker skin type ages somewhat later than really light skin, but basically the things you saw were the same. Over time, all the same things occurred: dark circles, fine lines and wrinkles, uneven skin tone. All these things happen to everybody, just at different time points. And then they test the product on every single Fitzpatrick skin type. And that's so important. And that's a big part of democratization as well. All Fitzpatrick skin types, making sure that products work for everybody. That's a huge, I think, push from this particular company. I give Neutrogena a lot of credit. I thought they did a lot of really good work on that pre-aging group of
It's true.
products.
And they won't let a clinical trial be performed unless there is diversity. And I know this because I just ran one for them.
I know you did.
And sometimes it's difficult to really get that diversity, to recruit the patients needed to ensure diversity. It's so much easier to recruit homogeneous population of patients.
Absolutely.
But it's not the right thing to do. And Neutrogena really pushes their investigators to do the right thing. And kudos to them, because we need to. And thankfully, it's not just Neutrogena. There's lots of
them working
pharma and skincare doing the same thing.
Yeah, almost everybody's doing it now. But if you think about a decade ago, Ted, nobody was doing it.
No, not at all.
And I do give a lot of our colleagues credits for raising the flag on that. I give them credit because they really turned the lights on, I think, for a lot of the cosmetic companies. But Neutrogena has done a great job. And they did that as well with many of the products that we talked about. They tested them in all skin types. So it's great.
You mentioned the aging changes that occur and how it's more of a not really a gradual approach, but it's more of a stepwise approach to aging. And that's based on Neutrogena data as well, which I don't know that we talked about in this series, but Neutrogena looked at over 180 patients, I believe. Patti, you know this better than I do.
Yes, we did talk about it. You
did?
Remember, we read the paper basically.
Oh, that's right. And that's the next episode that we're about to talk about.
That's the next episode, and that was a great study they did, where they really identified those aging turning points. And as you say, it's kind of like a stair step. If you look at the really light skin types 1 and 2, and then the 2s and 3s and the 3s and 4s, you get those turning points either in the mid-20s and around 30 or about 35. So it was really good work. And that was a big study that they conducted.